Hey everybody, I wanted to talk about an issue that's been in the news lately. Cassandra C, I believe her last name starts with. She's a 17-year-old girl who wanted to refuse chemotherapy for her cancer. And I'll jump to the conclusion. They ruled that she needed to have the chemotherapy. Well, I'm remembering freshman year of college having my moral issues class and reading this book. So, the first article that premiered about this issue was on Saturday, January 3rd, talking about the chemotherapy and the difference between freedom of choice and the mature minor doctrine. The mature minor doctrine provides for minors to give consent to medical procedures if they can show that they are mature enough to make a decision on their own. So, according to the babycenter.com cost of raising child calculator, if you live in a rural area with a population under 2,500, you're a single parent, your annual household income is less than $61,530, your child is between the ages of 15 and 17, and you are not planning on paying for your child's college education, you can expect to pay $164,160 a year expenses from birth until age of 6. According to health.costhelper.com/chemo.html, the typical cost for someone who is covered by health insurance to pay for chemotherapy is 10 to 50% of the drug. And the total cost is normally $10,000 to $200,000 or more for an entire treatment. So, in looking at that, I'd say that the American Childhood Cancer Organization is very important for people like this family whose mother is unemployed and a single parent and needs help. My opinions may not be too popular to handle, but in reading the article, which you can barely see, Teen's mother, it's her choice. I thought that the mother might be a little relieved that the daughter doesn't want to continue chemo because of the financial aspect, and that's why I gave you some financial background. But what if that's not the case? What if she's just trying to show her daughter that she supports her? Cassandra is only 17. The frontal lobe finishes developing at age 25. Maybe, if there's no traumatic brain injury, if there's on-course development and everything else, if there's no drug use, alcohol use, not even in utero when the mother is pregnant. But since Cassandra's brain isn't fully developed, she might be thinking about other things. 17, she's thinking about losing her hair. 17, the article said she hasn't left her hospital room in days. Well, she's probably thinking about fresh air, seeing friends, and that sort of thing. So is she able to cognitively think about the repercussions of her decision making? I'm not so sure. And I'm not so sure that her parent is thinking either. I admit it, I had to take back my thoughts about a 25-year-old versus a 17, almost 18-year-old when I read the article, Lawyers, Teen's Prognosis Good. And that really made me think, yeah, I still want her to live. I still want her to do the chemotherapy. But she's an intelligent young lady. and the doctors say she has an 80 to 85% chance of living with the treatment. And her argument is that the treatment could do more damage to her body than it would in saving her. I think doctors weigh the pros and cons and know what's best for you because they've done this a lot more than we have. This is our first and hopefully only time doing it. I already gave you the spoiler on how it all turned out. She is forced to continue treatment. In Cassandra's article about herself and her situation, she seemed very knowledgeable, and she really showed her emotions of what she was going through. When she decided to run away from home, people didn't know what happened to her or anything. She only chose to come back because it was assumed her mother was going to go to jail for it. So what I would say is, don't jump to conclusions. You should know that kids are susceptible to emotional outbursts. Cassandra, I love how brave you were through this whole thing. I only wish that you were a little bit braver and chose the chemo, because we want to see you alive and well. So many readers out there care about this girl Cassandra, and they want to see either DCF get fried, as a guy minor in Readers React to Cassandra C's story talks, and some have personal issues with cancer hurting their families and want to see this girl survive and beat the odds, where others, also having personal stories about cancer, want to see her avoid the pain and agony. There may be no right answer, but at least we're all having a voice, including Cassandra. And I wanted to focus on Cassandra's words instead of reading these other people's beliefs, because I want everyone to think about IEPs and writing these individualized education plans for our students who are ill or disabled or needing some other things. They need to have a voice.